Good morning. My name is Michael Stefan and I'm from DEX Innovation Center. I would like to welcome you to the EIT Health Morning Health Talk that we are organizing today in cooperation with EIT Health and DEX Innovation Center, who is EIT Health Hub in the Czech Republic. And I'm very happy that you join us today for another series of conversation that is going to follow up on the one that we had last Friday on the topic of digitization of healthcare. Today, we are actually going to look at case studies across Europe that were gathered through the vast experience of Philips Health Systems and Tomáš Vavrečka as a country manager, and also Teun Schutte from Mobility Europe Incorporated from Netherlands. And we are going to follow up on the case studies that will be presented today, also with a moderated panel discussion on how to innovate the healthcare ecosystem in the Czech Republic that is going to be led today by Adi Kaskel, who is an innovation writer, consultant, and also a writer for Forbes. So thank you very much for joining us. I think we have today quite a nice portfolio of speakers and people that will be here with us today. As I said, we will start with Tomáš Vavrečka after the introductions from Philips. And we will continue after that with Teun from Mobility Europe Incorporated. Before we will go to the discussion, the rest of the at the very beginning, there will be short introductions, and we plan to close today's event between 11:30 and 12. You will be able to meet quite some interesting people today here or as a follow-up. And of course, I'll be more than happy if we could potentially make ourselves comfortable, get ready and enjoy today's event, despite the fact that it's purely virtually. So in case that you are connected, we will more than appreciate if you can, for example, rename yourself in the participant list by including also your institution name and your full name, which would enable us to lead a more quality discussion in the moderated panel. Also, if you are connected and you have your camera available today with us, we will appreciate if you can switch it on so we could have a direct eye contact as well. If you are not speaking, having questions directly on the call, I would appreciate if you could mute yourself, because this might interrupt the other conversations on the call. Also, when we reach the point of the discussions and the questions from your side, please keep them with you for the time of the moderated panel after the presentation of Tomáš and Teun, and then you will get a chance to raise your hand through the functionality in a Zoom, which is called a reactions menu. Once you raise your hand in there, we will be able to see that you have a question. Also, you can write a question later on in the chat, even in English or in Czech. If you write it in Czech, it will be translated to the moderator in English from my side. And the whole virtual event today is actually simultaneously translated into Czech. So you can also select the audio channel on this Zoom call and press the interpretation and select the Czech or Český channel v češtině. Pokud jste dneska s námi, můžete samozřejmě sledovat celou dnešní akci v češtině. Stačí, když zmáčknete tlačítko Interpretation a zvolíte češtinu. Děkuji. This is everything from my side for right now. And the first one that I would like to kindly ask to provide a little bit more information about us at the very beginning is a nice host that we have today with us, who is Eva Guzek from EIT Health. Welcome, Eva, and thank you for joining us today. We'll be very happy if you can let us know a little bit more information about what EIT Health is and the purpose of EIT Health in Europe.
Thank you, Michal. Good morning, everyone. Thank you for inviting me to participate in today's morning health talks. As Michal introduced me, my name is Eva Guzek, and I work for the REASE program at EIT Health InnoStars. And it is my pleasure to welcome you on behalf of our organization. So for those of our guests who are here today for the first time or hearing about EIT Health for the first time, a very brief introduction. So our organization was established in 2015 as a knowledge and innovation community, so-called KIC, of the European Institute of Innovation and Technology. Right now, EIT Health is a pan-European network consisting of almost 150 partners from industry, business, research, and education. We are headquartered in Munich, in Germany, and have a pan-European representation through 6 regional offices. One of our flagship programs is REASE program, which stands for Regional Innovation Scheme. And the purpose of the program is to promote healthcare innovation in countries with modest and moderate innovation capacity. You can see those countries, well, that's the name or the capacity that they were given by the European Innovation Scoreboard. You can see those countries on the map here. So we, on top of working with partners from...
Pracujeme s partnery z těchto regionů, také snažíme spolupracovat s inovátory z EIT Health. Máme takový pool talentů a innovation solutions. V rámci programu nabízíme celou řadu aktivit pro naše partnery,
for example, proof of concept funding,
jako například financování proof of concept,
acceleration programs, as well as trainings and workshops. Therefore, I do encourage you to stay in touch with DEX Innovation Center because they do have all the detailed information about the upcoming programs and upcoming opportunities for the stakeholders in Czech Republic. And today's meeting, Morning Health Talk, is a part of the ecosystem development activities that we offer within the REASE. So the entire program is implemented through regional hubs, such as DEX. So those are leading regional incubators, accelerators, prominent medical universities, or business partners. And those hubs brings regional stakeholders together and discuss relevant healthcare innovation related topics. And the general idea is to meet in each region 2 times per year in a format of a business breakfast. I mean, as much as it is possible in today's situation. So the main goal is to have a moderated discussion with the stakeholders on current challenges in the ecosystems, because we believe that it is very important to identify and bring right decision makers together and provide a platform where we can learn from each other. So before I give the floor, I skip on purpose. During the last Morning Health Talks. But before I give the floor to the next speaker, I would like to provide an example of successful digital health solution, which is being incorporated in the healthcare system in Italy, thanks to the support of our organization. So we do speak about the programs, we do speak about different opportunities, but this is sort of a next step, which can happen after being involved with EIT Health. So the example is the Italian startup Patch AI, who won place at EIT Health Catapult last year. And now they have a successful cooperation with Roche Italia, and they are launching a virtual platform for cancer patients. And following the successful pilot of this platform in July last year, it is now available across sectors, and they delivered that solution to Roche patients. Basically, the idea is that the patients can self-manage their health condition through that solution. And thanks to this cooperation, both Roche and the startup, they try to ensure that they try to optimize the healthcare by ensuring patients' engagement. So this is one of the many examples within our organization, where big partners come together with smaller startups and smaller teams from different countries. And if you are interested in that topic, I also encourage you to tune into our Spotify channel, or I think it's an account. So there you can listen to Healthcare Hackers with the success stories and successful solutions that were incorporated through EIT Health, through EIT Health REIS program, and learn more. And I'm sure there are many Czech stakeholders also incorporated in those stories. So thank you very much. Thank you for the time, and I wish you a good discussion today.
Thank you very much, Eva. Yes, Healthcare Hackers. I remind myself that there is definitely a podcast being recorded with the winner of the Dexit Accelerator program from 2019, I think, InnoCure, which was also one of the best startups that reached the second rank in the InnoStars Awards competition of EIT Health, if I remember well. So definitely supporting this. Thank you very much. Also, thank you for being part of the EIT Health family. So thank you for the presentation, Eva. Also from my side, to give you a little more information about us, Dex Innovation Center, who is actually organizing this event for you today. Specifically, I will put on the screen now a little information about us as well. So as I said, we are the EIT Health Hub in the Czech Republic already from, I think, 2018. We have quite simple mission in Dex Innovation Center, which is actually to improve societies through digital innovation and research. And we are focusing primarily on 3 core segments: industrial, which is health, energy, and transportation. And inside of this, we focus on 4 main pillars of activities. One of them is raising the funds for innovation. The second is co-creating new products and services. The third one is building technological teams, startups, and the last one is education of different target groups. Now, when we will look more into the details of the fundraising activities that we do in Dex Innovation Center, as an example, in the last 9 years, we are able to raise more than 28 million euro for 14 large-scale projects. Looking at more details on the co-creation activity that we do in our institution, we are usually part of any of the process of the co-creation process of the development of new product or service, whether this is from the early stage of user-centered design, user acceptance testings, up through the piloting, capitalization, and exploitation of research results. Also, in the same time, we do the whole project management of the innovation cycle as well. Now looking at the build activity inside of our institution, so focusing on working with technological teams and startups, we currently have 83 alumni startups in our portfolio, including health startups like Cempia, InnoCure, and Tesla Medical. And also we work on many different programs and events with those teams, whether we are talking about awareness raising events and programs, identification events and programs like, for example, EIT Jumpstarter, hackathons, innovation days, or specific boot camps. Also, we run quite many acceleration programs on our own, whether this is the Dexit Accelerator program run from already 2018, or specifically the acceleration program for digital health startups, which is called For Digital Health. Also, we are very active in the segment of bringing international startups interested in the Czech market through the Bridgehead program. We also offer early stage investments to startups through the C Connector Angel Co-Investment Fund. And also we support all the EIT Health and other related acceleration program of our partners. In the incubation stage, after the acceleration, we also work with the startups that we accelerated through an alumni program. And looking at the last activity of Dex Innovation Center, which is actually education, we work with multiple different age groups and target groups, whether they are young people or people above 50 years old. We also look at them as a term generation ready, which means we try to work through multiple educational projects and activities to make them aware of the current situation around them, not as threats or difficulties, but rather as business opportunities. We are an EIT Health Hub from 2018. In the same time, we are also a hub for EIT InnoEnergy. And I'll close my presentation introduction with a couple of examples of activities that are now open from our side. As an example, again, this autumn, we are launching a specific acceleration program for digital health startups, not only from Czech Republic, but also from other countries. So if you might be interested in applying for it as a startup or becoming a partner of that, please get in touch with us, because this is going to run in autumn this year. Also, we are a successful partner of EIT Health program in cooperation with GE Healthcare, which brings AI usage in healthcare to students, but also practitioners from hospitals and other industry segments. The course for students has been successfully fully booked by 40 students from the Czech Republic already this spring. But there will be another course for practitioners that will be open also for practitioners from the Czech Republic, from industry and from the hospitals. So if you might be interested in that, please follow us. And the last activity which I want to highlight here is an activity that we do as part of the co-investment process to early stage startups. We are running a webinar on artificial intelligence next week on Monday, together with the speakers from Credo Ventures and also a practitioner and a few related startups from Slovenia and Croatia that you might be able to see on that event, that are currently in a stage of getting investment into their team. So that is everything about DEX Innovation Center. Let's look at today's event, the EIT Morning Health Talk. As Eva said, the EIT Health Morning Health Talks are regional forum discussions and networking platforms with the aim of co-shaping and improving the healthcare innovation ecosystem. So that's why we are inviting predominantly the regional key opinion leaders, policymakers, authorities, innovators, startups, investors, and healthcare professionals to one physical or virtual table to discuss common urgent healthcare challenges in European systems. Last week, we have looked at people-oriented digitization of healthcare and the examples from the USA, Portugal, and also a guest presentation on the relevant patient privacy and health data. Today, we are actually going to follow up on the discussion and the presentation with looking at specific case studies across Europe, as I said, from Tomáš Vavrička from Philips and Teon Šute from Mobikity. They are going to present some specific case studies from their experience in business, and we will continue and finish today actually with a moderated panel discussion today that will close all these two events from past Friday and today on the topic of how to innovate the healthcare ecosystem in the Czech Republic. So that is really everything from my side for now, and I would kindly ask the first speaker for today, which is Tomáš Vavrička from Philips, if you can take the floor with us. Thank you very much for joining us, and we'll be very eager to see more details about the case studies from Philips. Thank you, Tomáš.
So thank you, Michal. Only a short check if you can hear me well.
I can hear well, and we can see a correct screen. Thank you.
Okay, thank you very much. And Michal, once again, thank to you personally and to DEX for having me today. I think this is a great opportunity to go on in discussion about the digitization of healthcare system. And yeah, I'm happy to take the opportunity to share a concrete example how and what we have done in Philips in that area. And yeah, this is what I will talk about today. I will also shortly introduce Philips, also what we are doing. And yeah, you know, before the discussion today, I received a couple of calls and questions, and the people were asking, hey, Tomáš, what will you talk about? Yeah, Will this be again some fancy stuff of the future, or what this is about this time? Yeah. And I said, no. There are visions, of course, but we will be as pragmatic as possible and share a concrete
se být
example.
co nejpragmatičtější a sdílet s vámi konkrétní příklady, protože, jak vidíte tady, titul mé prezentace je Telemedicine.
Already living the reality, and yeah, this is my topic of today. Let me start with a short introduction. As mid of this May, Philips celebrated 130 years of existence of the company. We love to say 130 years of improving lives, as this is our mission. By the way, what you see on the picture, this is a Philips museum placed in Eindhoven, and I would recommend to go in because this is a very nice experience, and you will learn not only about history of the company, but also about all the products and solutions we are doing, developing, and providing to our customers. So, as I already mentioned, our purpose is to improve people's health and well-being through meaningful innovation. And this is what is our DNA, meaningful innovation. And our mission is to improve the lives of 2.5 billion of people per year by 2030. By the way, the picture you can see here, actually, this is also about future. It's already now existing, but not ready to be implemented in real life. But this is the direction where we are heading to. Yeah. But let me start with something more simple. I will explain you and tell you a bit more about health continuum, as we call it. And by this, we are focused on customer needs, which are the patients and the clinicians, and we are focused on improving the health. Healthy living, the healthy way of life, and this is the mission of Personal Health division in Philips, and later on you will learn a bit more also in terms of products. But as we continue within the continuum, it's about prevention, diagnosis, treatment, and then home care. And this is where the other products of our portfolio are stepping in with precision diagnosis, mainly ultrasounds, patient monitoring, remote patient monitoring, also computed tomography, magnetic resonance, and treatment, also image-guided therapy. And of course, it's followed by home care because as I explained, the patient is in the center of all we are doing. And of course, after taking some treatment in a hospital, it's more convenient to get ready again at home in the middle of a family. You have a different atmosphere. Also, the results of operation are very often coming better sooner, and so on. So the approach of Philips is quite complex. With this slide, don't worry, I will not go through in detail, but this is only to frame the discussion a little bit. So this is the healthcare continuum seen through products. So if you see on the vertical lines, there's a prevention, ambulatory care, acute care, then post-acute care, and chronic disease management. And below that, the level down, you can see the approach, some topics of Philips, how we are approaching actually the topics. So right on the start, when we are talking about prevention, it's about virtual coaching, because we are responsible for our health by ourselves. So we need to take care about our health. When some symptoms occur, it's good to check them on a professional way, and so on. So during ambulatory care, we focus on health kiosk, how to make the access to healthcare more easily, less time consuming, more effective. Then during the acute care phase, we help to be effective in caring, in curing all the diseases and solving the situations and so on, so on. So this is a bit about solutions, but for you to auditorium, to make it a bit more concrete, I decided to put here some examples, because the digitization, it's a big topic. Yeah? It can be about anything, but we do already have some practical solutions. We do already use some digitization approaches, and the first step definitely is a telemedicine. So in personal health, we can start with teledentistry. Yeah, when you are using the app, and you can discuss with your dentist actually what are the current results, what is expected to be when you should visit the dentist. So it's about optimization also of using the services of healthcare system. Then it's about innovation. I will mention here the Lumify ultrasound, because probably a majority of you do know how a normal ultrasound looks like. Yeah? It's quite something, yeah. But this is a first portable device which you can plug into whatever mobile device, being a tablet or own, and you can actually do the diagnosis already during the way to the hospital. When there's someone injured in a car, you can already the ambulance can already do the check and communicate to the hospital and so on. So these are little things with a huge impact, because you save valuable time and so on, so on. There are certain workflows behind that, and this is certainly something what is helping very much. Then to move on with the agenda, Philips is also focusing on the quality of sleep and breathing disorders. So then it's about monitoring, about remote diagnosis, then about treatment, optimizing of the treatment, of course about sharing the information, also about self-management through patients education, yeah, through various apps. Questionnaires are very often used, which are helping to optimize the communication and also the visits of hospitals. Then in more advanced solutions, we are talking about cooperation of professionals, yeah, how they do share data, how to secure them, how to innovate actually the how you can see the images, the way how the results are discussed, shared, and yeah, finally being diagnosed by clinicians and professionals. And then it's of course also about all monitoring systems within hospitals, implementing various types of alerts, which we implemented also during the COVID area. Very interesting solution, combining many parameters and giving actually a concrete alert to clinicians in advance, and this one precisely was giving about 30 minutes extra time before the patient needs to be taken to the intensive care unit, and that was actually the bottleneck of the whole system. And if the clinicians got the information 30 minutes before it happens, actually it gave them extra time to be able to step in and cure the symptoms and handle the situation, and by that also manage the workflow in a hospital. So this was about concrete examples. So actually, how we are using digitization right now already these days. And now let me share one concrete example coming from Estonia, and this is a very nice one because I like it very much. That was a top-down driven approach. I do not say this one is right or wrong or better, so please take it only as a example. But the goal actually was to deliver the value-based healthcare to stroke patients, because in Estonia, roughly 4,000 patients do suffer a stroke in a year, and 1 from 5 dies after 30 days after admission to home. So this is a very good topic of government to be looked in a closer detail, and think about how to change the system from the hospital-centric to the patient-centric system. So this was about transformational shift and about how to improve the patient care delivery. That's why also the National Insurance Fund of Estonia was involved, and also board of directors of 4 hospitals. And the discussion started already 2019 in, I guess, in mid of year. And there was a visit in Holland, in Customer Visit Center. There was a discussion followed by a co-creation session. And all these stakeholders actually came to Holland and discussed not only the goals. So the goal was the value-based care payment model, how to make it effective, how to enable it to the patients, but also the way how to implement it in Estonia. So having these stakeholders, National Insurance Fund, the Prime Minister of Estonia, and the Board of Directors on board, and the specialists from Philips side, the discussion started, and
začala diskuze a výsledky se dostavily, řekněme, o půl roku nebo 9 měsíců později, kdy byl vypsáno výběrové řízení, které se zúčastnila společnost Philips, také jako partner.
And we won the tender with a solution called QuestLink. And QuestLink you can also find on a internet with an introduction. And what is this? It's a massive questionnaire, to make it very simple. And then we needed to implement the solution within 3 months. So Philips needed to act very quickly to translate everything into Estonian language and to deliver all the security stuff all around. But we succeeded, and in September 2020, the solution was up and running, and was till end of the year used by about 30 clinicians. About 700 patients were involved, and the results were coming very soon. Because we can measure it very, very precisely. Because also International Committee for Health Outcome Measurement, the so-called ICHOM, was involved, and I implemented also one slide to provide you an overview of diseases where actually this solution can be implemented. And you can measure it very precisely. You are using the dashboard to give you a feedback about PROMs and PREMs. So this is the not only the outcome of care, but also the experience of the patients. And with these questionnaires, between checkpoints, between visit to clinicians, you have a very precise and detailed information, not only about how the patients are feeling, but also about their current status. This enables you to step into the process and maybe to postpone the visit or to call the patient a bit earlier to the hospital. And by this approach, we are able to analyze, to manage the relationship and the health of patients, and also the effectivity of clinicians very well. So the impact was quite clear. This is only one example. Yeah, if you go to the ICHOM website, you can have a look at all diseases which are mentioned there, and for all these diseases, this approach can be applied. So we can imagine that for value-based healthcare system, this is very nice tool how to manage not only the relationship but also the costs. So this was a flagship project of Estonian government, and they are satisfied with the outcomes, and already now they are thinking about some other areas where they will implement the solution. It's about hip or knee replacement, for example. Of course, the price is important. There was a certain limit set, 20 euro per patient. Of course, if you put more patients into the system, it makes the whole solution cheaper. Within the price, everything is included, hosting, servers, security, all the stuff around. Also, the way how this project was implemented was very important. I already mentioned that was a co-creating session. Here you can see some pictures from the process where both parties were present and actively taking part on this one. And we do not stop there. Yeah, we do also cooperate with startups. We have so-called HealthWorks program for cooperation with startups. So if there's someone on a call interested in a cooperation or in actually the development, what we are doing in that area, I would recommend also to visit the website Philips Ventures or HealthWorks. And this is it from my side for today, and I will hand over to Teun, and we'll be looking for your questions later on. Thank you.
Thank you very much, Tomáš, for a great presentation, and I'm happy to have the news about the museum in Eindhoven, which I might visit as well from my side. Very interesting one. So thank you very much. Teun, I would love to hear about the case studies that you have experience from Mobility Europe.
Sure, thank you. Let me see. Can you see my screen?
Everything is correct.
Perfect. Okay, well, thank you very much, Michal and DEX Innovation and EIT Health for this opportunity to share my experience in digital health. Today, I will share some learnings from digital innovation in the hospital setting. The cases I will present are from the Netherlands, but I'm sure that the lessons would also apply to most of the European markets. And I'm also looking forward to discuss to what extent they will apply to the Czech Republic. I don't have the time to go into deep with the cases, but I see it as an open innovation if you want to understand more of what we did and how we did it to reach out to me. But first start with introducing myself. My name is Teun Schutte. I have worked in the healthcare industry for over 20 years, 15 years for a pharmaceutical company in different roles, from clinical research to commercial roles, until I realized that if I really wanted to make impact in the healthcare system, I should step on the train of digital health. And that's when I started working for Mobility a little over 5 years ago, and dedicated my time to really helping clients with human-centered digital innovations. You probably haven't heard of Mobility because we always work for clients and create solutions in the background. But Mobility is a full-service digital transformation enabler, and we have offices all around the world on 9 different locations, and we help our clients by delivering compelling digital products. We do that in different industries, but today, of course, will be all about healthcare, of course. So first, let me start to share our key learnings that I will share today with you. And the lessons learned from our global digital healthcare partnerships. So first of all, make sure you have defined your digital innovation process clearly and keep it simple, specifically when working with partners, with clients, with customers. Make sure that everybody understands and that you have hard go, no-go decisions and stick to these and make it rational and not emotional. The second learning is about aligning the appetite for innovation. And this is already what Thomas was sharing with the collaborative workshops, for example. Make sure that all stakeholders involved are aligned up front to ensure that you won't waste any energy in convincing that it's a good solution or not. And the last step is always analyze your solution from 3 different angles. So look at user value, feasibility, and also, of course, make sure that you have sustainable funding. And I'm sure that you probably already learned about these angles, and you find these angles in all the innovation textbooks. But what you see happening is that people use these steps, the user value, feasibility, and the sustainable funding as a chronological order, instead of really looking at these steps throughout your whole process. So that's one of the key lessons. So let's start looking at the first process. And I'm not going to take you through the whole slide in every detail of it. And probably you've seen a lot of parts of this process, because this is the process. If you look at all the textbooks around digital innovation and you take the most used methodologies and you stick them together, you will find something like you see here. And it's really clear, or at least it's not really clear. I try to present this way of working, this process, during a client session. And I was really proud presenting this model when a client seriously asked me, Teun, are we designing a roller coaster or are we actually looking at a digital solution for kids with cancers? And that's when I realized that if you want to have a good customer engagement, that you really need to help them also with simplified process and make it really clear what to do and when to do it. So that's when we start really simplifying the process and focus on 4 steps. So the first step is to really define the areas of opportunities, to make sure that you know where you want to innovate, why you want to innovate, and how you want to innovate. Next step, of course, is validate if what you want to build or buy actually works in practice. Third step is get market ready. Make sure that you can implement your solution. This is also when you get your CE marking, for example. And the last phase is scaling your solution. And scaling your solution can be either within the hospital to other disease areas or to other hospitals, other markets, other countries. And I want to emphasize the steps in between, because it's really important to focus on the go and no-goes. And what you see often is that people fall in love with an idea. It happens all the time that we present a concept to a client and that they are so in love with the concept that they won't let go. Well, if we validate it in the second step with users, they absolutely don't see any value. So then you really need to make sure that you stop the project. And what you see in practice, that clients reach out to us all over this journey. So it's not clearly defined where to start. Sometimes clients ask us to help them build something. These are typical engagements which we did, for example, for Philips. And sometimes we take them through the whole innovation cycle and help them guide through every step of the process. That's a little bit too fast. if you look at the case that I want to present today, this is a case that actually, or cases actually, that follows the process neatly. It's a case about personalized healthcare in rheumatoid arthritis, in short RA. And it started off as a project from the Personalised Healthcare Catalyst Alliance, which is quite a mouthful. So I will call it PHC Alliance. And the follow-up project, the actual implementation of the solution was done with a solution from Dear Health. I also saw it on the presentation of Tomas. So let's look at the Personalised Healthcare Catalyst. The Personalised Healthcare Catalyst Alliance is a non-profit organization. They are committed to accelerate the transition to personalized healthcare. And they do this, among other things, by undertaking projects that contribute to this transition, for example, by identifying hurdles in the healthcare system and driving projects, really doing the projects themselves to prove that personalization can be done. What they showed in a recently published paper is the state of personalized healthcare in the Netherlands. And it tells us if you really take up personalization, you can win for chronically ill patients 2 to 4 extra weeks in good health each year, which is quite a lot. And if you extrapolate that to the general public, you can give them 3 to 7 years in good health over a lifetime. And what amazes me most is that this can be done mostly with technology that is already out there. The only thing that we need to do is to implement it in the right way. I think the project started early 2020 when the Personalized Healthcare Catalyst reached out to us and asked us to help them to identify projects that could remove hurdles in the healthcare system. And they asked us to do this for several disease areas like depression, breast cancer, but today I will focus on rheumatoid arthritis. And usually when we try to find the frictions, the opportunities to improve the healthcare system, we create a patient journey. And this is something that is probably widely done, and you are probably familiar with it. And if you look at this patient journey, it follows neatly the steps that also were presented by Tomas, from prevention to the first diagnosis, treatment, monitoring, maybe progression, and back to treatment and monitoring. And this is pretty standard work. But what makes it special in the approach that we took, and which I can recommend for everybody to use, is really looking at it from not only the angle of the patient, but implementing also, and you can see it on the left side, all the different stakeholders involved in the process. So we actually looked at all the healthcare professionals from the general practitioner, rheumatologist, but also a physiotherapist or a diabetic nurse, and interviewed them all to really understand what are the frictions in their part of the pathway. And last of all, we also incorporated the healthcare insurance companies to understand what they see as the most important frictions to solve. And once you bring that all together, you can find those places in the journey, in the patient journey, rheumatoid arthritis, where you can really try to accelerate innovation. And for the rheumatoid arthritis, one of the findings was that we could really improve the treatment pathway. If you look at the frictions, and I won't read them all for you because you probably can read yourself pretty good. But if you look at one of the frictions for chronically ill patients is that they had to come into the hospital a lot for routine checks. And we already know, and especially since COVID, that some of the routine checks can be done perfectly by telehealth or remote monitoring. But once they really wanted a acute check-in because they felt ill or they really wanted to ask something really personal, it was really hard to get an appointment. On the other side, we also saw that healthcare professionals although they have a really standardized protocols in the hospital, there was a huge variation in the way how they treated their patients, even within the same team. And we also know, for example, that there's a really high workload because they're simply understaffed, and it's only getting worse. And for payers, this is a pretty expensive disease, and everything to improve care against reasonable cost would be beneficial to them as well. So this is after really focusing on the friction, we created an ideation session, an ideation workshop. And remember, this was in the beginning of 2020, so everything was done remotely. And we were able, even with a huge group of stakeholders from all kinds of disciplines, to do a, well, actually pretty good workshop. The benefit is that everything is digital immediately, so it's less work to work out. But we created a workshop where we did an ideation session, and the idea that we came up with, or actually the whole group came up with, was, can we create a smart RA care pathway that delivers personalized health continuously, support the healthcare professional with the clinical decision to ensure that the whole alignment, the whole approach towards the patient is more aligned and better measurable, therefore. Can we make sure that the patient can look at the contact moments based on their needs, on what's really needed to treat them, instead of a standard set of consults per year? Can we give them an overview of their data? The patient is the most important source for data, but they don't have any means to share it with the physician, and let alone they have any means to really look at it themselves and understand and interpret it. And if you are able to do that, you can really engage them with their disease. And we all know that by engagement and better alignment in treatment, we can improve the quality, the experience. And if you do that, you can also reduce the cost in healthcare. So that's quite an idea and quite a challenge. So where to start? Well, even though as a company, Mobicity, we really love to build stuff, sometimes it's just better to recommend a client to take something that's already existing, to take something off the shelf. And this is when we walked across Dear Health. So for the people who don't know Dear Health is a company that was founded in 2019 by Daniel Hommes, who is a Dutch professor who also works out of the US. And they are specializing in improving health outcomes and experiences by really implementing smart treatment pathways, so AI-driven care pathways. Currently, they provide this solution in multiple disease areas, for example, in IBD, but also in ovarian cancer, and that's where they crossed our path, in rheumatoid arthritis. And the good news for them, last month they got their MDR approval, so that's was quite some celebration. And the solution really aims to support both healthcare professionals and patients in making the right treatment decisions and guide the patients to the proper line of care. So not only the third line or the second line of care in the hospital, but if it's possible, guide them back to the general practitioner or even to home treating. And make sure that the patient is treated at the right place at the right time. And this solution will help assist making the right decision. And we all know that the European government is looking at stricter regulations around AI. And one thing is that there always should be a physician involved or a person involved. And this is what they do. So they provide this decision as an option to the physician, who then can decide what to do or what not to do and what to give to the patient. And the best thing is that it does not always has to be done by the physician, but usually they put a care manager in between. And there are, at least in the Netherlands, it's easier to access a care manager because they're lower educated, but can provide really good care if you give them the right tools. What I will do now, I'm not going to share the complete tool and how it's worked and how it's used, but I want to share the learnings that we got from implementing this tool in a hospital in the Netherlands. And I want to focus it on the 3 angles that I discussed before. So first, the user value and driving user value. And what was our key learning by implementing this tool in the hospital setting is that you really need a dedicated physician who believes in the potential of value-based healthcare. You need somebody who likes to put some extra energy because you need to build collaborations. Collaboration with your IT team, but also collaboration with the other hospital and healthcare systems around you to make sure you can put the patient at the right place. Second of all, it's a change management process. And also last Friday, this was one of the topics. Digital transformation is not only about digital and about implementing a digital tool, it's about unlocking the full potential of the solution by guiding the team towards the new process and a new way of working. And not everybody responds to change in the same way. So guide them, support them. And the last way to really increase user value is the user engagement. Of course, this is about the patient. The patient is the most important source for your data. So make sure that the application you provide to them is easy to use and they like to use it. The more they like to use it, the more data you get, and the more data you get, the smarter your solutions get. So it's a really important part of the solution, and this is something that they're steering actively on. So the next angle is looking at the feasibility. And coming from a tech company, feasibility is usually equal to understanding the technical challenges of building, integrating, operating a safe and working product. But if you take a look from the hospital side, feasibility is about, are we able to implement this solution in the current workflow? Or maybe in the next workflow that we still need to design, but does it fit with our hospital and the way we work? And this is something really important to realize, that it's not only about, are we able to do it, but also on a technical side, but are we also able to do it on an operational, healthcare operational side? And to make sure that you can do it, take the stepwise approach. So take the small steps first. For example, what they did here is, from a technology perspective, they provided a solution as a web-based solution. To the medical record. And that's a lot of extra work. But once they saw,
to, co bylo předáno pacientovi, a tak, aby byl spokojený jak pacient, tak lékař. Lidé vlastně uvažovali, jaký by měl být ten další krok, aby vše bylo možno integrovat do toho
if you want to have it aligned with your order management system as well. So once you have proven your value, you can take the extra step and take the extra effort. So the last angle is about secure your funding, short, mid, and long term. And in the most of the engagement that we had with hospitals in Europe, I noticed actually that there's quite some funds to start innovation projects, at least in Germany, UK, and Netherlands, where I've worked. And these are usually relatively small amounts, up to 100,000 euros, to really test and implement a product, which works pretty well. But if you want to ensure the solution is actually paid for by the health system over time, by insurance companies or by governments, they will expect to see proof that the care that you deliver is cost effective in practice. And this can take up to months, sometimes years, to gather sufficient data to build your business case. And you can imagine the cost that you the money that you need, the funds that you need between your start, the implementation, the proof that it works and that people like it, and really proving that on the long term it's cost efficient. And unfortunately, I see a lot of projects struggle, and well, actually, a lot of waste created because they fail to survive actually this second section, this moment between being part of the healthcare system and being part of innovation. Unfortunately, there are a lot of sources to apply for funding, national or international, like the European Investment Bank. Only getting access to these funds requires a lot of grinding and a lot of paperwork. And therefore, it's often smart to hire these consultants. But to be honest, that always hurts me a bit, because hiring consultants to get funding for healthcare means that that money is not going directly to healthcare and to patients and to improve healthcare. So if we can improve anything here, it would be really, really good. In our case, their help actively helps hospitals to get access to these types of funds, to make sure they can together prove the case for this hospital, for this region. And this can be reaching out to the national, but also they have a lot of experience in reaching out to the European Investment Bank to together build this sustainable business case. So I hope that I have shared with you today our learnings. So clearly define your digital innovation process and make sure that you stick to your go and no-go definitions. Align the appetite for innovation, for example, by creating a multi-stakeholder journey, and always analyze your solution from the 3 different angles. So the user value, feasibility, and sustainable funding. So I'd like to thank you for your attention, and I'm happy to answer any questions or go into the discussion. And if you like to get more information, of course, either about the Personalised Healthcare Catalyst Alliance or their health, please feel free to reach out to me or to Michael by LinkedIn or directly, of course.
Thank you very much, Teon, for a great presentation and your learnings. And I'm especially happy because I believe in personalized medicine in the near future as well. And I'm happy that you selected this specific case because I'm the unfortunate victim of a similar disease like that. So I see it from the patient perspective, and I totally agree with the points that you said there. So we had 2 interesting presentations today from Tomáš, from Philips, and from you, Teon, from Mobiquity on the good case studies. From last week, we had interesting presentations about the people-oriented digitization of healthcare from the US and from Portugal, and we also talked about the patient privacy and the health data management. And I was thinking for myself, who will be the best person potentially to aggregate all these discussions together in something that could provide us a potential perspective on how we could innovate the healthcare ecosystem in the Czech Republic, because that is not going to be easy. Of course, there are a lot of learnings for us. And I think that the best person to lead such a conversation as an aggregation of the points and also as a Q&A for even Tomáš and Teon for today's case studies will be Adi Gaskell. So welcome, Adi, to the conversation today. I think you have the best profile because you are an innovation writer yourself. You are working with multiple startups, with other stakeholders in the UK as well. And also you are partly knowledgeable and experienced in the Czech healthcare ecosystem, but in the same time having an external point of view on our conversations here today. So welcome to the conversation, Adi, and I'll be very happy if we could support the conversation on this specific topic, how to innovate the healthcare ecosystem in the Czech Republic.
Thank you, Michael. It's a couple of really fascinating conversations there, and also from last Friday, it certainly left some interesting questions from my perspective, and hopefully from those in the audience as well. And if you do have any questions, do please pop them into the chat box, and I'll endeavour to sort of feed them into the conversation. obviously, if they're in English, that will be great for me. My own Czech is at the sort of Kotek level, but hopefully Michal will come to my rescue if you want to write it in Czech as well. So whether it's in Czech or English, do please pop your questions in there. Tomáš, I'd like to come to you first, if I may. I know way back at the start of the pandemic, it seems like a lifetime ago, Satya Nadella from Microsoft was saying that we underwent like 3 years worth of digital transformation in a couple of months. And I think healthcare has probably done even better than that, because it has really triggered a huge amount of digital innovation and transformation of healthcare. So I'm curious from your perspective, both from Philips and from the Czech Republic, what kind of technologies have you seen really coming to the fore as a result of the pandemic?
Thanks. I think this is a very good question, yeah, which appears, and I think it's good to have it here again. It's good for all the stakeholders to talk about this again and again, to be aware and to become aware again and again that if there's a positive approach of all stakeholders, you can do the innovation rapidly. Yeah, and this was during the pandemic very visible because you got not only the know-how, the energy to innovate from companies, from private companies, but also from governments and other stakeholders involved in the whole process. And we've seen it, I can mention even the vaccination. Yeah, we touched all the approvals needed to be approved and applied for the vaccine. And it showed up. We as a society, we are able to do that. And we have seen very similar approaches in Czech as well, developing various applications, supporting to manage the behavior of the people, to access remotely various institutions, information, and so on. So I think this was very visible, and yeah, for companies also interesting, because to innovate, to boost the know-how, to bring it to the market where there's, you know, like the customers are also ready to acquire these solutions, to use it. And immediately to see the impact not only on patients, because we are talking about healthcare, not only to patients but also to the personnel. It was amazing, and I think that I'm saying that based on Philips study, which was done among 3,000 clinicians, that the innovation after the pandemic area and the whole AI stuff, the digitization, is seen more than ever as one of main pillars of upcoming 3 years to be solved. So I hope this will accelerate also the ability to gather the resources, the funding, the budgets to support the development.
I know you mentioned in your presentation about telehealth, and obviously in your answer just then about the ability to access medical resources. I know in the UK during the first wave,
mít stálený přístup k lékařským strojům. Během první vlny pandemie
was a real challenge. People safe, but also giving them access to medical and the kind of care that they needed. Do you think, obviously as a population we're getting older, being able to care for our elderly population is going to be a really...
Poskytovat péči starším obyvatelům. To bylo něco, co vlastně s tím jsme se potýkali nejenom v Anglii, ale i v České republice.
We can see already some trends in healthcare, and it's already clear also to the management of the hospitals that the care will in upcoming years move from hospitals rather outside the hospital. Being supported with, we can call it telehealth or various applications by questionnaires which can be compared to the Quest link I presented as a concrete solution. And this is something what definitely can support not only the outcomes, but also the availability of hospital care, and to save the resources, to to work for the whole healthcare ecosystem more effectively. And this is a big win.
Yeah, I mean, it's so important, I think, and so necessary. Tern, I'd like to bring you in on this one as well, if I may, because I know Mobiquity did a study earlier this year into telehealth adoption in, I think it was UK, Germany, and the Netherlands. What were some of the findings from that study?
Well, if you look at the findings of the study, that of course you saw a big uptake throughout all the markets, specifically at the general practitioner, where we focused on during our research, and the uptake by the patients. And you saw that most of the patients were really able to use it and prefer to use these types of toolings. But we also learned that some of the toolings that were available are still really hard to learn. To use for certain age groups specifically, and maybe it's not even age group. There is a certain group of people that find it hard to use technology. And actually, this morning I read an article on the Dutch government tools that are offered currently, and which is specifically important with all the Corona passports and all the COVID passports that we need. That only 20% is accessible for people with a lower digital skills. So that's pretty shocking, and it's something that we found also in our report, although the numbers were slightly more positive. But yes, people like the tooling. A huge group of people want to keep on using these types of tooling, but I think we always should find the balance in making them easier and more accessible to use.
Were there any, you mentioned almost a digital divide between certain population groups, but was that also evident in sort of a rural and urban divide, with things like broadband speeds perhaps not being quite as high in rural locations?
Yeah, of course you saw internet connection as being one of the biggest hurdle to overcome, and to ensure that you have a proper conversation with your physician. And I don't know, I don't have top of mind if there was a huge difference between the countries, but that's something I can imagine that can play a role. But I think that if you look at a lot of solutions, that they're getting easier to use, even with low bandwidth. So yeah, I'd like to go back, because it looked pretty cool, to your roller coaster chart of getting things through into active service. And obviously, when you are implementing technology quite so quickly, it eliminates a lot of the hurdles that would ordinarily have been in place to stop digital transformation of healthcare. And the vaccine is a prime example that we had a technology that would ordinarily take multiple years, developed very quickly because we had that real need for it. Do you think post-COVID, we're going to go back to the old ways of doing things very slowly, or have we realized now that a lot of the processes that were in place or hurdles to go through weren't really necessary? I think absolutely some things are there to stay, like telehealth, like working from home and telehealth and these kind of things. People learned that it's possible to have a good conversation even online, and even through these types of channels. On the other side, you also feel the need for people to meet people in person. So specifically, we did some research at GPs where they took the role of GP. They became a GP to have personal contact with people, and they find it really hard to adjust to the new paradigm. So it's really also about change management and about people accepting the new status. The technology is there, the technology is ready, but people need to fully embrace it. And for sure, there's a need from the patient. And I think that solutions like the Dear Health solutions, where you as a patient actually get the option to see what is your preference, aligned with sometimes you need a physical check-in, that you really can bring the most of digital innovations to hospitals and to the general practitioner. So it's there to stay. I think the speed will continue, although we also will hear some of the old arguments against technology.
Yeah, I think that was one of the key takeaways from your presentation, almost, that the technology that we've seen during COVID isn't necessarily new. We haven't invented telehealth from fresh. It's been around for quite a while, but we've figured out a way to remove some of those barriers and get it into service at scale. So would you say almost that these process innovations, if you will, are almost more important than some of the technological innovations that we've seen?
For sure, for a larger to create a larger implementation and scale up within the health system, people like proven technology, and there's so much out there. Although I see a lot of this is not invented here, and people refuse using the technology, there's so much out there already, and we just need to help people to find the right solution for their problem and start trying it, testing it, and implementing it as soon as possible.
And you mentioned funding for innovation, and I think this is perhaps common across industries, but certainly for healthcare as well. There's been a lot of digital transformation investment into maintaining business as usual as much as possible, despite the peculiar circumstances that we're in. And obviously in healthcare, things like telemedicine sort of probably fall into that camp. Post-COVID, we're likely to have a situation where healthcare systems are quite stretched financially. They probably have a backlog of elective treatments to catch up on. Is there going to be
volit léčbu, aby vlastně dohnali ty finanční, vysoké finanční výdaje. Myslíte, že tady je možné dohledat?
Who's going to do the funding? So what I see is that there are a lot of accelerators.
Jsem říkal, je celá řada akcelerátorů.
Cash to fund a lot of projects, but it's pretty hard to get access to this money with a proper project. And sometimes, well, like I said, you need multiple consultants to help you, guide you through these processes, which takes time and effort, and therefore also more money, which doesn't go to healthcare. I think the hospitals will be more stretched because, of course, they had to reduce a lot of their exercises, their production last year. So I think there is money. I think governments, insurance companies see the need to accelerate, but they find it hard to put the money in the right place.
Yeah, and obviously you mentioned during your presentation the importance of having a physician on any sort of suddenly AI-based projects. We've seen doctors and nurses and other healthcare staffs stretched to their limit during the pandemic, and obviously burnout is very high, and time is at a premium. Is that also going to be a challenge for medtech innovators, actually getting access to physicians' time as much as their money and investment?
Of course, but on the other side, this is something that was always there. You always had a physician who wanted to put energy in something he truly believed in. Mm-hmm. And it could be medical research, it could be all kinds of innovations, not always digital innovations, but you always have people that really love to do it, and they just need to convince that you can really create more value, more time, less administration, for example, over time. So it's something you need to pick up with the team. Sometimes you only need to be a spokesperson, and you can use a non-medical staff to support you with the whole project. So as long as you have somebody who can really be the spokesperson and help you, guide you through the network, you don't need to do the work all by yourself. So I think I strongly believe there always will be people who will be driving innovation. Look for them, and there will always be non-medical staff who can support with these type of projects.
Yeah. So I know with sort of previous adoptions of things like electronic medical records, doctors have often struggled with the labor intensity of actually writing those notes, and some providers have introduced new roles, medical scribes and things like that, to sort of help do some of that administrative stuff. So that perhaps that's definitely the way forward, so that doctors focus on doctoring
and even voice technology, so you don't need
yeah.
Right, yeah, completely true.
I mean, obviously, during the pandemic, we, the general public, have been exposed to medical technologies at a scale that perhaps we haven't been for a very long time, whether that is telemedicine, the track and trace apps that we have on our phones, hopefully now the vaccine passports and so on as well. Do you foresee a bit of a shift in public attitudes towards medical technologies that's going to be beneficial for new innovations post-COVID?
Yes and no. So yes, the acceptance in this tooling, and that we need to do it just to get our freedom back and these kind of things. So people are accepting it. On the other side, as long as it's not seamless and it's going to be a hurdle to use it, or you need to be reminded to use it, people will drop it. So we are lazy by design. So I actually think that if you don't create a solution that it's almost seamless, almost working only in the background and only serving you when you really need it, you won't be successful. And that's a big step still to take. Even their health solution and other solution are really, you need to manually enter your data and do that over time. And if patients are not engaged to do it, you won't get your data and you won't get your smart solution. And that's where I see that where we still really can improve in the healthcare system.
Yeah. Do you think it sort of improved our inherent trust almost in sort of medical technologies? Because I know here in the UK we're rolling out a data sharing agreement with various research institutions, and there is a degree of opposition to that amongst the public, that they don't necessarily trust the government to handle that data ethically or safely.
Yeah, and I can imagine why. I don't share that same feeling personally, but I see it happening, that people don't trust the government, because if you have all my data, will you share it with my insurance company, and will I need to pay higher fees because I used to smoke, or I used to not sport, or used to these kind of things? And those are all the doom scenarios that people can think of, or maybe just that your data get on the street. On the other, so I see that objection. So I think we should have a good regulated system on who should get your data and how, and what you are allowed to do with it. On the other side, we also see a lot of people, if an insurance company actively sets up a sports program and you need to pay less fees, then they're willing to share every data. So there will be a big difference between user groups on what they want to share and what they don't want to share. And I believe that you should have an option as a user, as a patient, as a citizen to be able to choose where your data is and how to manage that.
Yeah, I mean, obviously the potential from a data perspective is enormous. It is just how we go about sort of ensuring that the general public come along on the journey with us, and they're sort of actively engaged with it and opting into it, I guess. And
yeah, I love initiatives like the data ownership, where you can actively share your data for example, certain disease areas to be used in broader research. So I have asthma, so I would share all my data on asthma research. But there are other types of research where I don't have the same binding with, so I won't share my data there. So I really like those types of participation, and that you are really in the driver's seat as a citizen.
Yeah, I mean, one thing that I've noticed during the pandemic, and obviously it was an issue pre-pandemic as well, across Europe, it's always difficult to scale medical technologies and medical startups, particularly across Europe, outside of your home territory? Obviously, Mobiquity have projects going on in multiple countries around Europe. Is that something that you've seen startups struggling with, whether it's through different regulations, different ways of assessing the efficacy of technologies, reimbursement models, various sort of challenges that might get in the way of a startup scaling their project internationally?
That's something I definitely recognize, specifically if you want to move between US, Europe, or Asia Pacific.
Yeah.
And if you want to play on every field at the same time, that's going to take a lot of effort and cost also. There are some, I don't know the rules by heart, but you can, if you actively look at your solution and what you have, you can plan your launch strategy properly. So sometimes it's better to launch in the US based on the type of product you want to launch and the type of regulatory approvals that you need. And sometimes it's better to start in Europe. So before you start actively, have a launch strategy already in place. And that's not something that you start thinking about. You first find an enthusiastic physician and a hospital who wants to use your product. But sometimes it's better to take a step back and really actively look, okay, what's better where it's better to launch? Is it US or is it Europe? And based on what regulatory approval that you need. Yeah,
I know EIT work hard to try and sort of support that internationalization. And before Tomasz had to leave us, he was talking about the work that Philips do working with startups. Do you think it's important that you work with a international organization, whether it is a startup or somebody like an EIT, to help you sort of navigate those challenges?
I would always recommend, it's fun. Networking is fun, and you learn a lot of people, at least I like that. But you always get new opportunities, new insights that you haven't learned before. And you always have to get the opportunity to create a better product, maybe align your product and these kind of things. So I would always recommend to make use of the local networks or regional networks, and to really look at how you can accelerate together and to take the lessons learned from other companies. And I see a lot of sharing of these kind of experiences. Company, it's all company secrets, while at this level it's still really open, and I really love that.
Is that culture change almost something that the pandemic has helped to support, because we are working as one society, if you like, but to sort of meet some of these major societal challenges, and obviously perhaps climate change is another one where we are working together towards a common goal, and that it's less sort of individualistic and dog eat dog?
For sure, it's getting even better, but I think even before COVID, I always liked the positive energy and openness and willingness to share experiences at these accelerators.
Yeah, I mean that's certainly my experience as well. It's always fun in more normal times when you can get together physically, and there's a real buzz and energy in the room that I think is really exciting. In terms of post-COVID, what do you see being the sort of biggest drivers of change? What are you most sort of looking forward to?
Oh, wow. Yeah, they're going to be quite well. Yeah, I, of course, like what we just discussed. So all the digitization, I hope we really can take the next step and not keep it only to telehealth. Also start thinking, how can we do better diagnosis at home? For example, in our way, what we encountered is one assessment, which is really important, is to do your joint assessment of your hands, for example. And physicians always say, no, we are the only one who can do it. And I really hope that also startups can jump on these kind of innovations, that people can do their assessment at home, because sometimes you only need to go to the hospital for a 5 minutes assessment and then you're done and you're ready. Well, I hope we can take the next step in looking at the whole patient journey and see, hey, are there still things that we can improve to really make the whole experience remote if possible? And that will be, for me, the biggest driver.
Yeah, I mean, I know the World Health Organization define health as being well rather than repairing us when we're sick. So perhaps a pivot towards sort of preventative care and keeping us healthy would be a positive change.
Yeah, but that's one of the hardest things to do. So people always like, if you look at prevention and staying healthy, it's hard to think about tomorrow. If you can do all these great things today,
yeah,
and not sporting today and eating some greasy food today and these kind of things. And of course, we need to keep it in balance, but we have the tendency to go for the bad things because we cannot project ourselves in the future in an unhealthy situation. And I actually, we not only see this in healthcare, we also see this in banking. People find it really hard starting saving with the same kind of reasons, the same kind of behavior that triggers you to focus on today and not tomorrow.
Yeah, but I like to remain optimistic because there are a lot of fascinating technologies being developed around sort of prevention, and you mentioned personalized care on that as well. And I think it is going to be an interesting time over the next sort of couple of years. Certainly, if we can find a way to really get these technologies into the marketplace, I think that'd be brilliant.
I agree, but it's also about what's your future goal? Is it, do we all need to get 100, or do we need to enjoy life also? So what's your societal goal?
Get to 100 whilst enjoying life.
Cool.
I want it all.
Agree.
Okay, I always like to finish panels with a Twitter round. So what are you allowed nowadays? Is it 240 characters? Thereabouts, I think.
Not sure.
In 240 characters, and I'm not going to be counting. What would be your key takeaway that the audience can take from both this session and Friday's session?
My key takeaways would be transformation is there. It's both technological, take a stepwise approach, but also from the personal, take a stepwise approach. We also need to bring along the public, the people who are doing it, but also the users.
Brilliant.
In the right way.
I think that was 240 characters, almost exactly.
Almost.
Brilliant. Well, thank you very much, John. It's unfortunate that Thomas had to leave, but his contributions whilst he was here were brilliant. Back to you, Mikael.
Thank you very much, Ade, for leading that conversation. I really enjoyed it. If you excuse me, I will still give you one question to you, Ade, on my side, because your
question for me, that's not allowed.
You have to be agile, as always. So, and the key question is, because you're somehow having the experience about the Czech healthcare ecosystem, you're coming out of the UK. You have a Czech wife, if I can say, right?
Yes.
What might be a potential case from the UK in terms of processes and innovations in hospitals that you could share with us and the Czech participants on this call that is something that is really inspiring for the other countries as well?
I think one of the things that is quite nice in the UK is each hospital or each hospital region has they're called academic health science networks, and their remit is to scout for interesting technologies, interesting startups, introduce them to the doctors, run the pilots, and then if the pilots obviously meet the required criteria, then to help scale that up both within that hospital but also in between regions as well. And it's really a nice facilitator of that pipeline from a technology at its inception through to deployment at scale. Now, obviously, that sounds fantastic in theory, and obviously it is nice in theory. There are challenges in terms of making it work effectively, and I know there have been a number of sort of budgetary issues in terms of scaling up some of the projects that have met a certain criteria. So it's by no means a perfect example or a finished article, but I think it's quite a nice example of how hospitals are looking to integrate new technologies into their way of working.
Mm-hmm. Great, thanks, Adi. This actually reminds me of a case of a speaker from a Finnish hospital that was part of an EIT Health event, which was talking exactly about, let's say, creating a process how startup could pilot and co-create their inventions in cooperation with the hospital people.
Yeah.
There was a specific design process because the hospital had or listened to the requirements from the startup that there was a lot of people actually coming to the hospital saying, we would like to work with you guys. We would like to test this. We would like to co-create this together with you. And I was quite inspired by the process that they have set it up. Of course, it was including some costs and some pricing for such a service, but the way that the hospital actually set up as a service for making these inventions to happen to life and to be created, I really liked. And I think what you are trying to say, there is something similar in the UK market. How do you think this is potentially possible in the Czech Republic as well?
I think it would be a perfect role for organizations like DEX to fulfill, because as Tun was illustrating, doctors don't have a huge amount of time. So if you're a startup and you go straight to a doctor, that's going to be difficult because they have great medical knowledge, but they don't necessarily know how to run a pilot or to the various challenges in terms of doing that successfully. So I think if healthcare companies or healthcare providers can tap into the expertise of either external bodies such as a DEX or build that expertise in-house, that makes the whole process that much smoother, because you're not relying solely on a doctor whose time is very valuable and very limited.
Thank you, Adi. I'm very happy for the conversation we had today and also we had on last Friday. Let me finish today's conversation with a short survey among all the participants today, because I will follow up on the discussions which was about the pre-COVID time and post-COVID time and all the fast development that we could see, especially in terms of the acceptance of the technology. Currently, EIT Health and Emerging Europe are running together a survey to help us understand the trends and desirable progress in the development of digital health across Europe. And we will highly appreciate your inputs on this survey, because there will be a white paper published from that, and of course you will be given the access to such a white paper on this survey. So I would kindly ask all participants of today still to stay with me for another 5 minutes, because I would like to share on a screen this survey and go through it together with you, because it is very important for us to understand about your perspectives on that issue. So I don't know if you have come across or not about a platform called www.menti.com. If you have a computer in front of you or a mobile phone where you could go to this website and use the code which is highlighted here on the screen, 439054 and 7. I will lead you through a short survey which will enable us and EIT Health to learn your perspectives on the digital health after COVID. So I will walk you through this. Let me just cross-check with my colleague Katerina, who is now on the call with us as well, whether you can see it correctly on your screen and whether that website works technically as well.
Yes, I'm there. Everything works.
Katerina. So if you are at www.menti.com using the code 4390547, let me walk you through the survey that will become inputs for this white paper that we are now building together, EIT Health and Emerging Europe. The first actually question is very simple. What is your profile? We had last Friday and we have today with us startups, parts of large companies, investor, healthcare practitioners, healthcare executives, and public authorities. Not so much we have students and academic institutions with us, but we actually have an academic institution with us today as well. Thanks to guys from University of Jan Evangelista Purkyně. So we'll be very happy to know your profile on this question. And then let's go to the second question. Also an easy one. How much, in your opinion, has the COVID-19 pandemic accelerated the pace of adoption of digital health in your country? Slide the bar between very little and a lot. And let's go to another question. There are 7 questions in total, just for your information. We are going to the third one. Have you observed any particular area where digital health development has been impressive? If yes, please, we will be very happy for your inputs on this question. If you have any troubles moving between the different questions, there should be a button on the screen which says the presenter has enabled another screen. If you click on it, you should be able to get to another question on the website if it doesn't flow automatically. So let's go into the question number 4. What kind of digital health solutions have been implemented due to the COVID-19 pandemic in your country? Now, this is obviously a question which shall be targeted towards Czech Republic. So please think about any potential implemented actions and digital health solutions in the Czech Republic from your experience. Let's go to question number 5 out of 7. Which benefits do digital health solutions help achieve from your perspective? Is it about reduction of costs, reduction of the process, cost efficiency, and all the other ones that are highlighted here on this scale? I'll be happy to understand your perspectives on this question. And question number 6, to move slowly there. The last one, which requires more time to answer. Which factors can contribute to a faster development of digital health in your country? Again, speaking about Czech Republic, those that have experience with the Czech Republic market, please, could you indicate the top 4 solutions based on your perspective on this issue? The first one is educating, upskilling healthcare professionals. The next one, educating patients. Next one, promotion of the digital healthcare, increasing trust of healthcare professionals and patients towards digital health abilities. Natural rise in demand of online healthcare solutions. Info site reference points for users. Favorable regulatory environment for digital health solutions to be used in hospital environment. Better standardization or scaling of digital health solutions. Improvement of the data security. And the last one, national strategy and initiatives to boost new digital technologies, establishing opportunities for startups to test solutions in hospitals. Which of these might be the 4 solutions from your perspective? And the last question from the survey is an easy one. Do you have any other comments that you consider important related to digital health in your country? If yes, please type for us on the last question, number 7. With this, I would like to thank you again to Tomáš from Philips, to Teun from Mobikity, to Ade from the UK, to lead the moderated panel discussion at the end. I would like to thank again to EIT Health to organize this together. And also, I would like to highlight the fact that in case you might be interested somehow as a startup or as a partner to become a part of the 4 Digital Health Acceleration Program for Digital Health Startup that we are going to organize in autumn, or you wanted to become involved in the Hello AI Risk program on artificial intelligence in healthcare from the side of a practitioner from a hospital or industry, or in case that you are interested in general in AI related innovations and you wanted to know more about how it is to invest into startups in this segment, feel free to join us next Monday on a separate session under the C Connector initiative that we are leading across Central Europe. With this in mind, I would like to thank all the participants for your time today. And we will be sharing the recording of today as well as we did for last Friday on our social media and our website. So if you follow us, you will be allowed to, of course, come back to any of the discussed points later on. So thank you very much. Enjoy the lunch, enjoy the rest of this week, and we hope to see you again soon on another opportunity. Thank you very much.